Yeah, awesome. Good morning, everybody. Welcome to the Martin Luther King Jr. Older Adult Center. My name is Catherine Ott-Level. I'm the Commissioner for Philadelphia Parks and Recreation. Great pleasure to welcome you all here today to one of our outstanding older adult centers. I'm going to begin by thanking Dr. Farley for his extraordinary leadership throughout the COVID-19 pandemic, but especially his work in ensuring that residents receive their vaccine in places like our older adult centers, our recreation centers, so many of our sites around the city that are so accessible to residents of our city, that where residents feel comfortable, places that they know and trust. And we're just so grateful to be a part of this wonderful effort at Parks and Recreation with the Health Department. I want to thank Council President Clarke, who's also joining us here today. And over Council President, we are in the Council President's district. Not only is he Council President, but he is the great council representative for this district. And Martin Luther King Jr. Older Adult Center has a very special place in this gentleman's heart since he built it. And we're so grateful to the Council President for all of the support of all of our assets throughout his district and beyond. I want to thank the Parks and Rec team who work here at MLK Older Adult Center. Barbara Gillette, who is our Director of Older Adult Services. Jackie Maldonado, who's the site supervisor here. I want to thank the Advisory Council and their leadership who have support all of our efforts here. Michelle Wilkins is our social worker. Sharon Sykes is our receptionist. Joe Miller is our caretaker, and Mary Lilly handles our food services here at MLK. It's an incredible lift, not just certainly the health department, but our special events office, as well as all of the staff here at MLK helped to make this possible. MLK has been going throughout the pandemic, as well as all of our sites at Parks and Rec. This has been a grab-and-go meal center. It's also been a home base for our staff to reach out and stay connected to seniors, both over the phone and virtually. And now today it becomes a vaccine clinic. For months now, Parks and Rec has been a critical part of the response to COVID-19, providing essential services such as running 40 access centers where students complete their virtual learning, providing safe and clean places for residents to gather outdoors, serving as meal distribution sites across the city, hosting COVID testing sites, and now providing the first mass vaccine clinic in a recreation facility in the city. This is an exciting day. The work happening here at MLK makes me thrilled to get back in this building and begin bustling with activities and programs for older adults at this center, and of course across the street at MLK Rec Center as well. We'll begin welcoming kids very soon. Parks and Rec is so grateful to all of the essential workers, the frontline staff, and to those who've made incredible sacrifices this year. We know how hard this pandemic has been on all of us, but we're so happy to be a part of the solution. Thank you to all of the amazing Parks and Recreation staff who continue to play such a critical role in supporting the city's COVID-19 response. Please join me in welcoming Council President Darrell Clarke.
Thank you, Commissioner. Good morning, everybody. Commissioner, thank you all. During the course of the last several weeks, months, there's been a lot of discussion about vaccinations, a little bit of controversy, but the bottom line is, the underlying theme is that we need to get vaccines in people's arms, all right? And we've asked everybody to come together, because this is the single most important thing that we can do at this point in time, because it's keeping us from getting our kids in school, it's keeping people from going to work, it's keeping us from our traditional everyday life. So until we get these numbers down and until we get the herd immunity, we're not going to get any sense of normalcy in the city of Philadelphia and in this country. So I'm excited to be here today as we start this process of vaccinating people in neighborhoods. There's been this discussion about these large-scale facilities, and that's all great, drive-thrus, convention center, but the people live here. And you will see during the course of the day, the people from this neighborhood will be going in the Martin Luther King Older Adult Center, a place where they go all year long until the pandemic hits. So this is so important, and we need to be doing this throughout the city of Philadelphia to make sure that we give this very, very critical opportunity to the residents of our community. So I just want to thank you all so much for starting this process and moving this along and getting this in a place where we need to be, where everybody has access to getting a vaccination. So thank you.
Thank you very much. So first I want to thank Catherine Ott-Level for being a great partner with the Health Department on this initiative. for everything we've been doing on COVID and then for vaccination in particular. And then also Council President Clarke for really keeping his eye on the ball here, what we really need to do to ultimately get past this pandemic and his support throughout all of this. We have been offering vaccine through a variety of different channels across the city. Hospitals are vaccinating, federally qualified health centers and other health clinics are vaccinating, pharmacies are vaccinating, employers are vaccinating some of their own employees, such as the police department and the fire department. Dialysis centers are vaccinating their patients, and their community providers like the Black Doctors COVID Consortium. And the health department has been running mass clinics. Now, the health department until now has been running mass clinics for healthcare workers, and we have not done that with press. It hasn't been quite so much public because it's really been focused on just the healthcare workers. We've been doing that at various sites. What's new today is this is going to be the first mass clinic run by the health department for people who are eligible because they're in phase 1B based on their age and medical condition. Okay, so people in the community. The people who are invited to come here today are the people who signed up in our vaccine interest database. They provided their information, and so based on their age and their medical conditions, they're invited to come here today. Now, today's clinic is the first in a series of clinics. We're going to be doing first dose clinics per week for the next 3 weeks. And then after that, we'll be doing 3 first dose clinics and 3 second dose clinics per week until we no longer need to do that. That's going to be quite a while. We'll be back here, same place, in 3 weeks to give the same people who are getting vaccinated today their second dose. Now, these clinics, as you see, it's a range of different ways in which this vaccine is being made available, including the large clinic that's going to be at the convention center. But these specifically are designed to be in Philadelphia's neighborhoods, so they're easy to access, as the council president mentioned. Today if you go inside, there are 8 different stations to vaccinate people. We expect to vaccinate 256 people today. It's going to be an operation from 10 o'clock to 4 o'clock. And then as we do these clinics, depending on the size of the facility and how we get our system down, we hope that those numbers will grow. This Thursday, we'll be at Community Academy of Philadelphia at 1100 East Erie, and then we'll have 12 stations. And then this Saturday, we're going to meet at the University of Sciences at 835 South 43rd Street in West Philly, and then we'll have 10 different stations. Now, there are 1.2 million adults in the city of Philadelphia. I wish I could give it to every one of those 1.2 million adults in Philadelphia today. Can't do it. It's still going to take us months to do that. But we're going to keep at it until everybody has had their opportunity to be vaccinated, and we hope a very high percentage of those people ultimately vaccinated. So today is just one more step in that process towards ending the epidemic. And I should say, I think you've had an opportunity to look inside. It is inspiring also to talk to the people who are being vaccinated. I just met an inspiring woman here. I think you may know her name, but I just met her. 99 years old, lives 2 blocks away. She's our first customer here today. She's been coming to this center for 43 years. Okay, so we're making this available at her center to protect her, and she's clearly medically vulnerable. That's the sort of people we want to vaccinate here today. Thanks for coming, and with that, we're happy to answer any questions.
Where are we with vaccine doses? Are we seeing an increase already in what we're getting to the city, or not yet?
Yes, we've been seeing a gradual increase over the past few weeks. We were getting about 20,000 first doses per week. Now we're about 30,000 first doses per week. The federal government does not guarantee what we're going to get in the future, but I'm hopeful it'll continue to gradually increase.
We're getting more details about the FEMA clinic.
I've got the press conference later, so I'll give you a little more details, but it is scheduled to begin on March 3rd. I'll give you more details then.
Why did it take so long to get these 3 vaccination sites up and running?
There's a lot of work to be done setting up something like this. And, as I said, we have been doing mass clinics until now, but those mass clinics have been for people in phase 1A, healthcare workers. So now we're moving into phase 1B. So you haven't seen those clinics, but we have been doing those.
Are there plans to do something like this in the Northeast?
Currently, we have these 3 sites I mentioned, okay? And depending on where you're talking in the Northeast, the one of them is a little more northeast of here. We will look at additional neighborhoods in the future, but we don't have any other ones set right now.
Were there other sites being considered close to this in this area?
Not so much in this immediate area. We got a large city to cover, and So no, I should point out, not just for this sort of clinic, there are also these many other channels where people can get vaccinated. Federally qualified health centers, hospitals, pharmacies, etc. Okay, that's right. Yeah, the 20th and Berks is one of the health centers not far from here that is offering vaccinations on a regular basis.
How are people being notified that they have an appointment?
So the people, they sign up on our vaccine interest database, either online or they called our the health department and we signed them up. And then based on their eligibility, we contacted them either by internet, email, or by telephone and asked them to schedule an appointment. So everybody's here by appointment only.
When did the appointment for this site start opening?
I believe we sent out the notices last Friday.
Are they given a time, a specific time?
They're given a specific time. There's so many minutes per appointment. It's maybe 8 or 10 minutes per appointment. Okay, so you'll see a sort of steady stream of people all day from 10 to 4. Okay. All right. Thank you all for coming.